In this PowerPoint, we are going to discuss few question and answer from psychiatric and mental health nursing. Most of the question and answer here select all that apply categories. It helps to prepare for NCLEX licensing exam. Question 1. A nurse is assessing a client who talks freely about the feelings depressed. During the interaction, the nurse hears the client state, and things will never change. Right? The client's talking about this. For what other indication of hopelessness should the nurse assess? Select all that apply. So when a depressive patient comes to you, what are the signs and symptoms you could evaluate? So depression is a common mental disorder that is affect more than 264 million people in worldwide. It is characterized by persistent sadness and lack of interest for pleasure in previously rewarding or enjoyable activities. So number one, boost anger or period of irritabilities, preoccupations, that delusions, feelings of worthlessness, self-destructive behavior, and auditory hallucinations. The correct answer is 1, burst of anger, 2, period of irritabilities, 4, feelings of worthlessness, and number 5, self-destructive behavior. Restaurants say the clients who are depressed and feeling hopelessness are usually irritable and express inappropriate anger and suicidal thoughts. In addition, they may have a feelings of worthlessness and demonstrate the self-destructive behaviors. Preoccupations with delusion and auditory hallucination are generally seen in the client with schizophrenia or other psychotic disorder rather than in those express the hopelessness. In this page, we are going to see some sign and symptom of major depressive disorder, like patient complain, persistent sad or feeling of empty all the times, feeling of hopelessness or feeling of guilty or helplessness, irritability and restlessness, loss of interest in activities or hobbies, also difficult to get concentrations. Even they lost the interest in about the opposite sex, right? Next question, a recent diagnosis, a cancer has caused by the client severe anxiety. The nurse care plan should include which intervention? Select all that apply. So this question about the severe anxiety. Severe anxiety, also known as panic attack or anxiety attack. So number one, maintain a calm, non-threatening environment. Teach the relevant aseptic of chemotherapy. Encourage the client to verbalize his concern regarding the diagnosis Encourage the client to use a deep breathing exercise and other relaxation techniques during period of increased stress. Number 5, provide distraction for the client during period of stress and teach the state of grievance. Correct answer is number 1, maintaining a calm, non-threatening environment. Number 3, encourage the client to verbalize his concern regarding diagnosis. Number 4, encourage the client to use deep breathing exercise and other relaxation techniques during the period of increase the stress. Rational said, during acute stress, intervention that help the client regain the control will help the client master this new threat. Provide a claim, accepting attitude, and encouraging verbalizations of concern will help the client face the unknown conditions, because panic attack or severe anxiety begins all of a sudden without giving any warning, right? So they can strike at any times or may have occasional or frequent attack. So relaxation techniques have a physiological and psychological effect in claiming the client, which in turn allow further explorations of thoughts and feelings as well as the problem solving. Learning is limited during extreme stress, so teaching would not be effective at the stage. Providing distraction would be ineffective at this point in the grief process. Teaching about the stage of grieving is not appropriate at this time. Here we can see some common symptoms of severe anxiety, like patient complain of chronic fatigue, restlessness, irritabilities, difficulties of concentration, difficulty of sleeping, and also muscle tension. So generalized anxiety disorder, if it is excessive, means more than um, more than as usual, or persistence means does not go away, and also unreasonable, should not be audit. Anytime can occur without any reason. So we have to follow diagnostic and statistical manual of mental disorder to diagnose a case of severe or generalized anxiety. Here's some options, treatment options for generalized anxiety disorder. Basically, we try to adjust with the anxiety and control it. So if you do not know how to deal with it, anxiety will eat you. So self-medication, psychotherapy works on. If not enough, we go for medication, anxiety medication, anti-anxiolytics, tranquilizer can work. Next question here, in the emergency department, a client revealed to the nurse a lethal plan for committed suicide and agreed to voluntary admission to the psychiatric unit. Which information will the nurse discuss with the client to answer the questions? How long do I have to stay here? Now, what should be your response? Select all that apply. Number one, you may leave hospital at any time unless you are suicidal. Number two, let's talk more after the health team has assessed you. Once you have signed the paper, you have no say because you could not hurt yourself. You must be safe before being discharged. Number five, you need a lawyer to help you make that decision. Number six, there must be a court hearing before you leave the hospital. So these questions about the suicidal ideations. The correct answer is number one, you may leave the hospital at any time unless you are suicidal. Number two, let's talk more after the health team has assessed you. So patient can verbalize their feelings and patient can leave the hospital anytime. It is the right of them. Number four, because you should hurt yourself, you must be safe before being discharged, right? So suicide is a major health problem, right? So it is very important the person who have a suicidal ideation or in contrast to a history of suicidal attempt may represent and increase the suicidal risk, especially if this ideation has developed into or means to perform the action. So increase the discussion about the health, about the death, and also allow the patient to verbalize their feelings. So we have to deal with the patient very therapeutic way. To rational say, a person who is admitted to a psychiatric hospital on a voluntary basis may sign out of the hospital unless the healthcare team determine that the person is harmful to himself or others. The healthcare team evaluate the client conditions before discharge. If there is a reason to believe that the client is harmful to himself or others, a hearing can be held to determine if admission status should be changed from voluntary to involuntary. Telling the client that he has no say in how long he stay desire the client rights. The client does not need a lawyer to leave the hospital. A hearing is not mandatory before the discharge. A, also, hearing is held only if the client remains unsafe or require further treatment. Here we go and see what are the signs of impending suicide. Increase the use of alcohol or drugs, increase risky behavior or confrontational, moody, irritable, sad, angry, and interested, hopeless, helpless, or withdraw. This is the most common sign of suicidal behavior. So also as a healthcare provider, we have to learn how to recognize a suicidal behavior in among the clients. Poor work poor school performance, eating problem, also sleep disorder. Some patient is giving a possessions away or finalizing a will, also access to a weapon, right? Here we go. What is the patient care? Like, which is very important, frequent observation and also possible one-to-one observation is good. Also, effective way of communication with the patient. Psycho-counseling works, develop a therapeutic relationship with the patient, written behavior contact with patient, and also restraint is ordered. It is safer for the patient. It is good if we remove all kind of dangerous equipment tools from the patient room, like sharp object, razor, any kind of cigarette, or any cord, phone, equipment. It can easy to use for suicide. Next question, after interviewing a client diagnosed with recurrent depression, the nurse determined the client potential to commit suicide. Which factor should the nurse consider as contributors to the client potentials for suicide? Select all that apply. Number one, psychomotor retardation. Number two, impulsive behavior. Number three, overwhelming feelings of guilty. Number four, chronic debilitating illness. Number five, decreased physical activity. Number six, repress of anger. Correct answer is number two, impulsive behavior. Number three, overwhelming feelings of guilty, chronic and debilitating illness, and also repression of anger. Rational said impulse behavior, overwhelming guilty, chronic of illness, and anger repression are factors that contribute to suicide potential. Psychomotor retardation and decrease the activity are symptoms of depression, but do not typically lead to the suicide because the client does not have the anger to harm himself. Here we go and see few more information about the major depressive disorder. So who are depressed, they go for suicide, right? So repeated major depressive episode within last more than 2 weeks or less than 2 weeks, episode occur less than 2 months apart. The common criteria or symptom here 1 to 9, but they said must have at least 5 of the followings, or one of which must include first 1 or 2 symptoms, like depressed mood, inability to express the pleasure, appetite disturbance and weight change, sleep disturbance, insomnia or hypersomnia, psychomotor disturbance, agitations, feeling or loss of energy, feeling of worthlessness or feeling of guilty all the time, decreased concentrations and decision-making skill, recurrent suicidal ideations, also marked distress or impaired of social or occupational functioning, no evidence of physical or substance-induced etiology. So what are the nursing intervention? So it is very important who are depressive or who have a suicidal ideation or suicidal thoughts. It is important to find out, right? So interact with the client in a slow speech and low volume or firm tone, encouraging him or her to verbalize his or her feelings, thinking, or worriedness, using broad leading statement or open-ended questions so patient can talk more. Also maintain a therapeutic distance, exhibiting open posture, and do not hurry the client when interact or instant to patient and show a sense of empathy. Next question here, a nurse develop a relationship with a client who has a addiction problem. Which information indicate that therapeutic interaction is in the working phase? Select all. So here we go and talking about the addiction problem. So addiction problem basically a chronic brain disorder. Addiction is a chronic brain disorder and not simply a behavioral problem. It involving alcohol, drug, or gambling or sex. So they said here, it has developed relationship with a client who has a addiction problem, which information indicate that therapeutic interaction is in the working phase. Number one, the client addressed how the addiction has contributed to family distance. Number two, client shared the family history to addiction. Number two, client verbalized difficulties identifying personal strength. Number four, client discussed the financial problem related to the addiction. Number five, express uncertainty about the meeting and the nurse. Number six, acknowledge the addiction effect on the children. So correct answer is number one, the client addressed how addiction has contributed family distress. Number three, the client verbalized the difficulties of identifying personal strength. Number six, the client acknowledged the addiction effect on his children. So what are the rationale? Addressing how the addiction has contributed to the family distress, verbalizing the difficulty or identifying the personal strength, and acknowledging addiction's effect on his children indicate that the client is in the working phase of the nurse-client relationship. In working phase, the client explore, evaluate, and determine solution to identify the problem. And also sharing the family history of addiction, discussing financial problem related to this client addiction, or expressing uncertainty about the meeting with the nurse are events that occur during the introductory phase. Here we go, and here we will talk about a little bit more about addiction problem. First of all, identify what is the nursing intervention. Identify the type of substance that the person has been used and the amount, frequency, method of administration, and length of time the substance have been abused. Because this question about the addiction and addiction to the substance abuse. Also, note of any suicidal ideations or interest, right? Assessment for level of motivation for treatment, want or does not want. Identify the reason of admission, or a baseline physical and emotional nursing assessment is done to determine the admission status and provide baseline from which to determine the progress towards an expected outcome. Here we go and see what are the potential nursing diagnosis of addiction patient or substance abuse problem. So they have altered the nutrition. They are under risk for fluid volume deficit, altered thought process, sensory or perceptual alterations, maybe auditory or visual or both, sleep pattern disturbance, altered health maintenance, self-care deficit. They does not like to follow personal grooming, non-compliance, hopelessness. They all the time feel sad, crying, no pleasure, no interest, no concentration, self-esteem disturbance, increase the violence or violence to self and others, anxiety all the time run behind of them, ineffective individual coping mechanism. In this PowerPoint, we discuss few question and answer. If you practice like this, it helps to get your NCLEX licensing exam.